Patients may have heard the term shared decision making. Let's let's define it though. What is it and how does it work?
Sure. So if you imagine you're a patient faced with the daunting task of a new cancer diagnosis and trying to navigate decision making around treatment or whether you need a certain test, and those tests or treatments have harms and they have benefits. Shared decision making is really the process of communication, open, transparent communication between the doctor or provider and that patient and their family and supportive spouse and others, significant others, so that everybody has complete information around the risks and benefits of a certain treatment course or management course. In prostate cancer, this would mean for a newly diagnosed patient, commonly, first giving information about what the risks of their cancer might be, but then what the risks and benefits of various treatment algorithms might be, and explaining in ways that a patient can understand those different journeys. And then ultimately, the patient makes a shared decision making with the doctor that's in their best interest.
In your view, what role do patients have in care decisions, and why should they feel empowered to speak up and be a partner in their care?
Sure. There's many different types of doctors, there's many different types of patients, and you have some patients that have PhDs, you have some patients that are not even sure what cancer is. And it's really important to empower every patient to understand at a level that will help them make a decision. And some patients wish to have those decisions made for them. I hear that a lot. Some patients really just want to, ingest the information, not make a rash decision, maybe get 3 or 4 second opinions, travel around to really get the right decision. And sometimes it can take a very long time. But every patient has a different journey, and it's important for the provider, the doctor, the nurse practitioner, or the surgeon to really understand that patient and their values, to help them arrive at the decision for themselves. Because sometimes treatment decisions may have equal efficacy, but different side effects. For example, in prostate cancer, the most common decision is between active surveillance or a radical prostatectomy or radiation of different forms, or the robot versus the open procedure, or intensity modulated radiation or brachytherapy. And these are complex decisions. And I've had patients go for months without making decisions. And the shared decision-making approach really can help patients make a decision as quickly as possible so that they can move on and either be cured from their cancer or make the best treatment decision.
Dr. Armstrong, why is it so important that patients tell their doctor about any symptoms they're experiencing?
Certainly, symptoms may or may not be related to the prostate cancer, and doctors are well trained to sift through all of that. Back pain could be from a herniated disc or arthritis, but it could be a sign of metastatic disease. Weight loss could be a sign of other metabolic problems, but it can also be a sign of really advanced prostate cancer. Urinary symptoms could just be a sign of a big prostate. It may have nothing to do with the cancer, or it could be a big tumor that's blocking off your bladder. So being transparent and open and just describing what symptoms and letting that physician, sort through that with you to help understand what symptoms may or may not be related to the cancer. That's really important.